I just want to make a reflection on this, which I think is very important. And it has to do with the overall argument of health and investment. And we've gone, at least for 20 years, starting with the World Development Report of 1993. Then there was the Macroeconomics in Health report in 2000. Then there is, last year was the Lancet Commission of Investment in Health. And now we have all these reviews. And the case is always made that health is not a spending issue. It's an investment. It promotes growth. It creates the right settings for a productive investment. It goes on and on and on. And I do wonder how effective that message has been. And of course, in all those documents, pandemic controls and preparedness have been part of the most useful or the most persuasive examples that is always presented. And yet, reactions are not as desired. So what's creating this lack of responsiveness, of awareness? We all agree on it, but the messages don't seem to get across, or at least from what I've seen, the dialogue is not has not been as profound as possible. I'll just leave it at that. You can.
One comment in response to that, though. I think one of the things that struck me on the comments here is that there's a very strong financial inclusion agenda going on, and it's related to poverty alleviation. So producing, giving people access to banking accounts. So you can argue that from a poverty perspective is something that's really important, but it struck me from what you said that actually it's a pandemic preparedness issue at the same time. So the more you can pull the pandemic stuff into mainstream through a variety of links, I think the more successful you're going to be at getting the kind of responses that you want.
I agree. So we'll take the question of Prashant.
Thank you. I think when we talk about private sector engagement, we often lose sight of some very low-hanging fruit and start thinking about these complex PPPs which require architects of PPPs to spend considerable amount of time, the Lesotho example, many others. So I think two low-hanging fruits that I want to highlight to the panel and get the reactions. The first one is, in many middle-income countries, private path labs and lab networks are very extensive. They can serve as a surge capacity at the time of a pandemic for governments to get surveillance and lab reports out. But that cannot be initiated when a pandemic strikes. And one opportunity we have, which we are missing, is for the Global Fund, which invests in HIV, TB, AIDS, malaria, and things like that. I mean, they could start the conversations for the recipients to already start having some sort of private lab capacity within the grant, so that when the government needs to use that surge capacity for pandemics, there is already a structure in place. Instead of starting a structure only for a pandemic, it could be built around our current systems. And that's relatively light touch work. It doesn't require a complex deal structuring. The second is an idea for global companies, and I think I seem to agree with Trish's comments on that. So if you look at business continuity planning, if you look at MERS in South Korea, I think the mobile phone companies who have a very strong sourcing footprint in South Korea are the ones which are more worried about MERS than anybody else. But the challenge is each one of them does their business continuity planning, risk management independently. So instead of a government heavy-handed role of let's partner and do something, if the government was to play a very light touch role, or the public sector was to play a very light touch role and say, we'll bring you all together. We'll just provide the platform. No money, no risk sharing. We will not do anything complex. We'll just bring you guys together so that you can share amongst yourself. I think that's another low-hanging fruit, which can yield a large outcomes. I'll stop there. Thank you.
Thank you. We have another question back there.
This has been a really interesting conversation. I'm Anne-Marie Kimball from Chatham House, and in one of my former lives, I worked with the Asia-Pacific Economic Cooperation for 7 years to advance emerging infections into their policy priorities. They now have a standing health working group in APEC, and it was the cost of epidemics that drove that. And we worked with the Clinton White House on that, as CDC and others, and China and Korea and Canada. But bringing in the Asian experience a bit into this scenario would be, I think, very useful. But I need some clarity on terms, because what I find as a public health person is that I understand things and I hear the terminology being used in different ways. So my understanding, there's basically 3 levels one can look at. One is the CSR level, which you've mentioned. The other is the doing business level, which is what I heard in public-private partnerships as that term was used. And then there's the business service space, which is Rotary International, for example. I haven't heard much about Rotary. I know in Liberia they were very active in Ebola. And I'm curious because what I also heard was this is a competitive space. And many companies are reluctant to share their business continuity plans because they see it as a competitive advantage. And the point about business service organizations is they provide you with a non-competitive space, and epidemics are not a competitive space. Very quickly, whatever business continuity plan one company has will fall if it's not coordinated both with the public plan and with their next door neighbor company. It's been proven with AIDS and with avian flu and with many other epidemics. So I guess that's kind of a commentary, excuse me for going on, but perhaps we could clarify where's the business service organizations in this mix according to the panel?
Thanks, Anne-Marie. I think it's definitely something that we thought about as we thought about the kind of in-country presence of private sector and what they can do. And I agree. I think it's going to be hard to explicitly link business continuity plans in their generic form. But once you're in a crisis, I think these companies are very interested in knowing what each other are doing and knowing what each other are observing and seeing. And I think that's where we believe some sort of private network is very important. And I think the advice would very much be build on what you have. So where these associations and other kind of business service capabilities or capacities exist, absolutely build on them. They're not everywhere, and there may be places where new things need to come in. But I think there's a very clear role. So I would totally agree.
And for giving private sector input into the design of the thing,
Yeah. The other nice thing of an entity like that is that it's a one point of contact for the public sector. So the public sector doesn't have to go company to company. It provides a clear focal point. So I think that's the other big advantage of the private network, whether it's something new like EPSMG was in the case of Ebola, or it's something better, something existing. I think we have a better chance if we can build off the existing.
Thank you, Trish. Mr. Godal?
I just would like to basically try to answer your question in relation to the reports and analysis that we have had. So the 1993 development report of the World Bank on health, according to Bill Gates, was the most important document in terms of him deciding to make health a topic for his foundation. That led to then more systematic evidence build-up around what the benefits from investing in health was. And we had, the bloom on health and wealth of nations in science and so on around 2000. And ODA for health increased from about 5 to 6 million, and we'll get into the 2000s up to 30 billion. So there has been a very, at least significant coincidence between those reports and the increase in ODA. And of course, AIDS was a very important factor in that. And so as a health emergency, AIDS was important. Now the difference between that and those that goes away was that it stayed. But I'm always an optimist, and I really think that we're going to see something. This is going to be different. This is going to lead to really new investments and smart investments in relation to pandemic preparedness and prevention.
Well, we hope so, since the adrenaline rush is down. But do we have a question back there?
Thank you. Paolo Sison from Gavi. Thank you for the conversation. Very interesting and lots of things to unpack. But I'll limit myself to one question. It was encouraging to see the significant level of interest and commitment from the private sector to be involved in response to a pandemic or crisis, under the premise that preparedness is better value than response to the crisis. I would imagine that commitment would also cover preparedness, or can potentially be translated into preparedness if we make that case sufficiently clear. So tying that to some of the conversations earlier today and yesterday around health systems strengthening as a component of preparedness, and hopefully an increasing movement towards standardization of what is best practice in terms of health systems. And as a result of that, identifying gaps. So if one were to break down health systems into their components, a number of these components are bread and butter for the private sector, right? Their management skills, organization, their data, their logistics, on which the private sector lives or dies in terms of their own business models. So it's interesting that the panel comprises colleagues who touch different facets of the private sector. So I'd be interested to get your views on, to what extent is an active dialogue occurring between countries who have identified or are in the process of identifying the gaps that they foresee in their health systems, and trying to see which of those gaps could provide areas of interest or areas of opportunity to the private sector, whether that is described as a roadmap or a strategic plan, and whether those conversations lead to donated services or semi-commercial arrangements. I think it would just be interesting to see your perspectives on how actively that is happening, and what the future for that might hold. Thank you.
Thank you. You want to take that, Stacey?
Sure. Adrian Fenty was the ex-mayor of Washington, D.C., and a good friend of mine ran one of his departments, and he would start every staff meeting by saying, surely somebody has done this before, right? We can just copy what they're doing. We really don't have to invent this from scratch, do we? And I think that's a very good kind of model for ways that governments like the UK, for me, the UK should be putting in a template and dispersing to all financial systems throughout the world how they ran this simulation, the sector-wide simulation exercise, and that would be an enormous contribution for them to make, I think. In terms of kind of this areas, so I don't know empirically to what extent that's happening. I'll leave that to other panelists to answer. But to your point of kind of opening up areas of opportunity, and Daniel touched on this earlier about just having in place the mechanisms, having in place the snowblowing contract, having an entity that has already issued in the markets before, so that when the time comes, you can just kind of pull the trigger. And it occurred to me that there's another area where this can be important. And again, I turn to bond markets and how we think about bond markets and the importance of the government establishing a yield curve in government debts that the private sector can use to price its own debt issuance. And in the same way, I think that the government at a sovereign level engaging in these financial instruments, taking out insurance policies, can be a very important reference price for the private sector then to also protect itself with insurance policies. And I was talking to Nikhil earlier about this, and he said that the state of New York, or the city of New York, was it, or city of New York did bought surge protection insurance, which is now traded, and so now the private telcos can use that pricing to do their own telco insurance. And I guess last, kind of related to this, when I think about how can international actors contribute in kind and in the way that they conduct their own business. I think, Trish mentioned this before, sort of the supply chain work that, companies like Walmart, run these big simulation exercises with their entire global supply chain, very important. Governments, to your point, kind of making this information available. And I think the last piece of this, and I admit that I'm just really looking for a way to get on my, maybe this is a little forced, but I'm looking for a way to get on the soapbox because it's important to me, is that if governments and aid agencies can do their best to kind of do no harm and not destroy local markets, and in particular the outrageous and unconscionable U.S. aid policy of tied aid, for example, just for me, getting rid of that policy alone and sourcing locally and food aid, not destroying agricultural markets, et cetera, could be a very important component of the recovery from these pandemics. Thank you.
Thank you, Stacey. Daniel, you want to?
Yeah, I mean, if I could sort of just reflect on some of the comments so far, and I don't know if the panel would agree with me. I mean, there's almost three ways that the private sector would look at sort of the pandemic situation. At its most extreme, it's when a pandemic is happening. Then there's this whole situation around preparedness. And then there's this broader question about investment into public health. And how the private sector engages, I think, is slightly different in all three cases. And I think there's a sort of blend as these things go in. But generally, I think in a pandemic situation, frankly, I think the private sector really wants to help. It sees the issue completely, and it's just trying to find a way and a mechanism in which it can best bring its own skill sets and resources to bear. And I think what we saw in Ebola, I hope, was quite a lot of that in terms of the private sector across telcos, finance, mining, logistics, all looking for mechanisms to kind of contribute to. And so I think that's pretty clear-cut, I hope. I'll let others disagree with me. I think in the preparedness, I think increasingly the private sector is very much aware of this from its own business continuity point of view. So for example, we took a lot of lessons from SARS to Ebola, and so we had in place all the SARS protocols, which were very useful in terms of when Ebola struck for us. And I think you're seeing increasingly companies in the private sector look beyond their own BCP into the broader thing. So HIV was mentioned earlier. You're seeing, mining companies increasingly looking at providing antiretrovirals, for example. And here, I think you can have a situation where the private sector can be encouraged to do more. So I think it will naturally sort of think about its own BCP. And then I think if there's a framework and sort of some moral suasion and also some incentives, I think they can then build into a broader BCP for an economy. And I think that wouldn't take too much more. I think where it gets quite tricky is this investment into public health itself. So when you're looking at the broader public health of an economy, how do you encourage private sector to go there? And I think that's partly because there you're talking about very long-term public goods, effectively, and private sector companies need to answer their shareholders. So the question is what are they going to get back from their money? And that is a little bit antipathy to how we run most healthcare systems, where the commercial profit doesn't necessarily sit very neatly in a public healthcare system. I think there can be mechanisms, and I think David mentioned the PPPs, and there are other ways to maybe marry the two. But I think if you're looking for an investment into public health more broadly, we do need to get that incentive correct, and it's a little bit different from the sort of pandemic and preparedness cases.
Thank you, Daniel. We'll take a last question from Mr. Liu.
Well, I just want to offer a comment with observation about the role of public sector in dealing with pandemic event. I think we should never underestimate the contributions that the public sector can make. At least in the case of China, where when we were debating on the direction of healthcare reform or towards more centralized or market-oriented, a very popular illusion or misperception about the role of private sector was that private parties are profit-driven entities, right? While the public entities are not. Therefore, public interests, implying that private parties, entities cannot make contributions, at least in in the case of emergency cases where it's hard to make a profit out of it. Now, the private hospital owners disagree with that kind of argument. They say, look, if you just look at actual participation in every major public participation in dealing with the pandemic events in the last 10 years in China. We were there every time, if not sooner, in the battle. So I was so curious. I think this is good data for if you guys want to write a case. I was so curious, who is right? So I checked the data, and I found an official report by Ministry of Finance and other ministries, okay, about the actual figures of contribution by different parties. And add them up, believe or not, private entities, NGOs, private hospitals, individual contributions together make almost 50% of the total contributions for earthquake in Wenchuan County back in 2008. So that tells me that private parties can and have actually made huge contributions, but that's not well recognized, at least in China. So I think there's a great room for private entities to make much contributions than we thought. Okay, thank you.
Thank you, Mr. Liu. Olga, do you have a?
One thing that's very relevant to some of what you were talking about was very interesting on preparedness. Most institutions and also the World Bank have an emergency policy about how they are going to be assisting in emergencies because they occur for some reason or another periodically. And under the World Bank's emergency policy, we have a provision for so-called contingent components. And this is, there's a big project, there's several components, and you add another component that's only activated in an emergency, but it's already in the project, so it's, it can be very quickly. You don't have to go through the whole process of processing the assistance for the emergency because the component is already there. Moreover, it's normally not funded, what we call not funded, there's no money in it. But the money can be transferred in it from another component, like in a day, very, very quickly. And so there was a discussion of this policy about 7-8 years ago, and some sectors actually use it. Okay, it's used quite widely in urban, a little bit in agriculture, and surprisingly, in health, it's not used at all. Okay, so this is evidence of sometimes we have the instruments, but nobody is actually compelled to use them. So during the lending for the health sector, which is very substantial, 30, 40 projects a year, $1 billion in portfolio value, it just, I guess, never came up, but the instrument is there. And it won't happen unless, on our side, we are required to do it. Or the board, tells us every time they see a health project, like, wait a minute, is there preparedness? Are you ready in case something happens in this sector? Because, these are very large operations, usually. But anyway, so it, hasn't occurred yet. And in those components, they can be designed as much as you want. There can be procurement, that's advanced procurement with the private sector, in the country that would be available to provide the supplies. It can be done at the time, anytime. It doesn't have to be done in advance, but it's good to do it in advance. There's also a provision for advanced financial management. There's an emergency FM. So, sometimes there are already ways. So maybe, for some things we don't have to find new ways. We just should activate the ones we have, at least, for some cases.
Thank you, Olga. Very important. I think. One last question.
I want to highlight
The last of the last.
one private flow which we are somehow not incorporating. That is remittances, right? I mean, we know there are 60 billion or more of remittances. Liberia receives probably a very large sum, much bigger than ODA or out-of-pocket health expense coming from remittances. So I guess one question that I keep asking myself is there no role for direct or foreign remittances for pandemic financing? In some ways, they keep local markets alive. They are how local markets function in the time of a pandemic. Should there be something that the global architecture and community should think about, or that we should just leave that alone and not tinker with it?
Daniel, it seems like you're the.
I think you're absolutely right, and I think we do need to think about it. I don't think I have an answer off the top of my head of how, but I mean, I think if you look at, we've seen a few bond market products effectively aimed at expatriates in several markets, and I know several other markets are looking at it, and maybe there is a way of combining that plus some kind of catastrophe bond type structure that could be aimed particularly at sort of expatriates or people that are sending remittances home. So it is a very big flow, particularly into sort of a lot of the countries that are susceptible to pandemics or to extreme effects of pandemics. So I think it's definitely something worth thinking about.
Thank you, Daniel. I think it was very informative. A lot of questions raised, a lot of questions answered. Well, join me in thanking the panel, and thank you very much.